Well, thank you, everyone. I really am enjoying this nice, warm Dallas weather. I know that we're after lunch, so one thing before I start, if everyone could just stretch a little bit. I'd have us do jumping jacks, but if we could just stretch and wake up a little bit, get the air moving. All right, good. All right. I don't want anyone falling asleep on me. Okay. So this is not the title that I picked. It was a title that was given to me, so it helped me to sort of think about ways to talk about personalized medicine. So as we go along, I'm going to be talking sort of from the trenches as a clinical geneticist, and I'm going to give you some examples of how we're actually using some of the technologies that we've heard about today in actual practical medicine. But the expansion of this over time is kind of unimaginable, but I'm going to be giving you very practical guidelines. I'm also going to be telling you about my own personal genetic information, my disclaimer. So I chose to share this with you. Okay. So I have no conflicts of interest to disclose, and these are the primary objectives. So the objectives are to have you guys, after this talk, hopefully, be able to have some practical ideas about how we can actually use these tests for patient and family treatment for at least one disorder, hopefully a few more, and to talk about pharmacogenomic testing and how to tailor treatment for patients, because these are practical things that we're actually using today. And then I have developed some secondary objectives. These ones I threw in. I think that we're going to talk about variants of uncertain significance again, and I'm really glad that Dr. Brower sort of kind of gave you some background on that and other talks. I also want you to be able to ask some questions when you're ordering a genetic test. So just because you can do testing doesn't mean you always should do testing. So before you order one of these tests, we should think about why are we doing it, what's the value to the patient, how much is it going to cost, all of those things are important. And then we're going to talk a little bit about actually looking at the genetics of pathogens. I threw that one in there as well. So I'm hoping that I talk about the beauty of genetic testing and not the terrifying aspects of genetic testing here. Okay. So what is the promise of personalized medicine? How many of you know about some of these not commercial laboratories that are offering genetic testing? Okay, so how many of you have heard of things like 23andMe was mentioned before, but there's others. I don't have any preference. So I want to tell you, I participated in one of these personalized genetic testing, but I didn't pay for it. I did it on a research basis, so it didn't cost me anything. So I gave them some saliva a few years ago, and every once in a while they give me some information, and I'm going to share some of that with you. So what is the promise of personalized medicine? Everybody holds it out. Oh, you know your genome, you're going to know what to do with your life. Well, it may help you make some lifestyle decisions if you know certain things and to improve your health, although most of us know some of the things that we should be doing. But it also can help us as clinicians pick the right medicine, the right dose of medication, maybe avoid some complications of some of the treatments that we give patients, and those are all great benefits. I'll be talking about that a little bit. Can tailor treatment for things such as cancer by looking not at the genetics of the person, but the genetics of the tumor. So I'm going to talk about that for a little bit. And then a little bit about looking at viruses and bacteria.